All right, this is a short video showing a CT scan or computerized tomography scan, CT scan or CAT scan of the pelvis, particularly focusing on the sacrum and coccyx in a patient who underwent a coccygectomy, and the first coccygeal bone, which is this bone right here, was essentially left behind. So it's a partial coccygectomy rather than a complete coccygectomy. I'm Dr. Patrick Foy. I'm the director of the Coccyx Pain Center online at tailbonedoctor.com. And in this short video, we're going to just review this. The reason why we know that that is indeed the first coccygeal bone is from looking at the anatomy. And again, if we look at, in my book, I have a whole chapter on anatomy. I'm holding the camera with one hand, so I'm trying to show you with the other hand. In the chapter on anatomy, if you look here, you can see that the first coccygeal bone has these two areas here, these two areas that come up, these two, they call them horns or cornu, that are extending up from the top of the coccyx there, projecting upwards. And those meet the sacral cornu that are coming down. From the side view, we can see that cornu hooks up like that. So coming back to our CT scan here, you can see those cornu right here, coming upwards from that remaining coccygeal bone. And if I swing around, you can see them very nicely here. Again, this one and this one projecting upwards. Those are signs that this is indeed the first coccygeal bone, those coccygeal cornu or horns projecting upward to meet the sacral cornu, which are here, that are projecting downwards. So this is where the first coccygeal bone was left behind. I'll show you that in one other spot here on an anatomic model here of the coccyx. Again, you can see those horns or cornu heading upward, just as we see here. So that is indeed the first coccygeal bone that's still remaining in this patient who underwent a coccygectomy. So unfortunately, there's lots of times where patients are told that what they're having is a complete coccygectomy, and sometimes the first coccygeal bone or other coccygeal bones may be accidentally or inadvertently left behind. And then we need to decide, should they have been removed? Most people do not need coccygectomy removal surgery for their tailbone pain, but in those who do, it needs to be a conscious decision made with the patient and the surgeon about whether to do a total versus a partial coccygectomy. And if the decision is to do a total coccygectomy, then you want to make sure, of course, that indeed all of the tailbone is removed and that a piece of it is not accidentally left behind. So I just wanted to point that out since this is a good image for showing that. And that's all for now. I hope this has been helpful at distinguishing partial versus complete coccygectomy. For more information, you can get lots of information in my book, which you can get online at Amazon. It's Tailbone Pain Relief Now. And I hope this info is helpful for you. If you need more information about tailbone pain, you can find me online at tailbonedoctor.com. Thank you. Bye-bye.